Hi everybody, I'm Dr. Nigel Brayer. Thanks for joining us again today. Hope you enjoyed last week. This week we're going to be talking about acupuncture and our upcoming seminars. This Thursday at Heinen's at 6 o'clock and in Brecksville, and next Monday at our office at 7 o'clock. We're going to be talking about acupuncture and anxiety. I've had a lot of patients and actually teachers come to me and say, Doc, what's the deal with anxiety these days? It seems like every kid in my classroom has that diagnosis. And this one patient I actually spoke to today, she said 40% of her students are on anti-anxiety medication. They're in the 6th grade. So it's pretty scary statistics. And she asked me, she said, Doc, why are people getting diagnosed with anxiety so often? What is the common medical approach? Why are they on medications so much, like antidepressants and different anti-anxiety medications, and what can be done? So we talked about acupuncture as a very legitimate option. And she wondered, well, what can acupuncture do, and what is acupuncture? Because most people don't have much understanding of that. They just know that needles might be involved. So the key to acupuncture is, in my understanding over the last 22 years, is it's like a reset button. So if we have somebody who has chronic pain, who has anxiety, who wants to stop smoking, who has addictions, acupuncture is like a tool that can use as a reset. So what I like people to think about is, if you imagine that you're a master piano player and then somebody asks you to forget how to play the piano, that would be really difficult. So acupuncture helps us restart. So when it comes to anxiety, anxiety goes with worry, insomnia, constant inability to sleep, things that make us uptight and anxious. Those are pretty common symptoms of anxiety. Now, we all get those once in a while as an individual. However, when they become chronic and debilitative, that becomes a bigger issue. So the acupuncture is one of our top tools to help break that cycle, amongst other lifestyle changes that we'll talk about at our upcoming seminar. So I wanted to show everybody what an acupuncture needle looks like. This is a standard needle right here, and it's very, very small, as you can see. So the whole premise behind acupuncture is, in traditional Chinese medicine, there's 12 primary meridians. There's actually 72 meridians, but the 12 primaries are the most important. So those two interact with all different systems in the body, and when there's imbalances in those meridians, then in time symptoms occur. So what the acupuncture needle does is it helps in specific points to help balance those things out. So I'm going to use an example here on one of my staff members, Jessie. So Jessie over here, we're going to go ahead and insert this needle. And what we do is we use a guiding tube, and that guides the needle where it needs to go. Now I'm going to put this in a point, it's called Li4, which is a very important point as it relates to neck pain and headaches. So I'm going to go ahead and insert it right there. And that would be the acupuncture needle. Jessie, did that hurt at all?
No.
No. So what we would do is, for anxiety and other issues, then we're going to place them in very specific points, and those points will have an effect. And most people will notice a difference within a few days. Now, of course, you can't change things. Thanks, Jessie. You can't change things overnight. It takes some time. And usually anxiety or any condition is related to a whole bunch of dynamics that need to be addressed. So we'll talk more about that at that upcoming seminar. So this Monday night, Living Tree Center for Healing at 7 o'clock, Anxiety Answers. Call to reserve your seat. There's limited space available, but we'd like to accommodate as many people as we can fit in here, so please call. We'd love to see you. And then we have our upcoming seminars in the next few weeks. We're going to have our Facebook Live coming up. We're going to be talking about body aches in the next few weeks. And next Tuesday, we're going to have Facebook Live. The whole seminar will be broadcast on Monday evening. Have a great day. See you next week. Bye-bye.